All right, welcome to week 3. In this module, we'll talk about writing CME, continuing medical education. This is an entire industry in and of itself, and you can just make a really good living as a medical writer just writing this type of materials. What is continuing medical education? So it refers to the accredited educational activities that help healthcare professionals maintain competence and improve patient care. If you're a clinician, you know you have to keep your continuing medical education credits current, and there are medical education providers and then freelance medical writers like us that do work for those providers, and we create those materials usually with the help of a key opinion leader or a clinician. It's offered by academic institutions, medical societies, hospitals, and professional education companies. Our company works with all of these types of entities, but mostly professional education companies. Most of our bread and butter in the CME industry space comes from these professional education companies. I'll talk more about those in a little bit. CME covers things like clinical updates, guidelines, treatment advances, and healthcare systems. Basically, if you go see your doctor, these are things you want your doctor to know when treating you. Anything updated, any new approvals, any way they can make your outcome better. That's what CME is training clinicians to learn about. And then it's loosely divided into creating CME materials, which are manuscripts, slides, and the kinds of materials that clinicians learn from, right? So that's the kind of the end product of the CME materials. And then a large part of what we get paid for is to write these needs assessments. And I'll talk more about those in a minute. Core principles of CME writing. So it's got to be educational and not promotional. There are ways to subtly recognize who is supporting the activity, but it still has to be fair balance. I'll talk about that. And free of commercial bias. Just the facts. Audience focused, it needs to be tailored to the specific clinical role that is being educated, so physicians, nurses, pharmacists, and the like. It needs to be outcome driven, so it's aimed at changing clinical behavior or improving patient outcomes rather than just providing knowledge to the clinician, right? Knowledge is good, but actually changing clinical behavior, like resulting in an earlier diagnosis of a patient or using a more effective regimen as per the guidelines, updated guidelines. So that's changing clinical behavior. And then it needs to be compliant. So where it must adhere to the ACCME or similar accreditation body standards. CMA content formats you may write. So needs assessments and gap analyses. This is pre-creation of the materials. So these are included in a grant that your client will use to get funding for an educational program. Needs assessments and gap analyses. Slide decks and speaker notes. So when you see a clinician at a conference give a talk about something, it's often a continuing education program, and those slides are often not created directly by the person speaking. They are created in collaboration with the key opinion leader, but often some medical writer has done a really detailed and thorough job on that slide deck. Clinical cases and scenarios, some online materials that clinicians can work through and be tested on. And then another part of CME is creating effective pre-activity and post-activity tests and knowledge checks. You want to see that what's being taught has actually made an impact in the activity of the clinician, of how they treat the patient. And then agendas, learning objectives, and summaries, those are part of needs assessments. And then the best way to get CME writing work, if you're taking the paid version of this course, then you will have the opportunity, hopefully, to subcontract with my company. And the best way to get in with my company is to offer to write needs assessments. These are often long and unwieldy, and that's what most of this module is about. We'll talk about how to write those. But you can offer to do those, and it's a great way to get in with us as for work and do a really good job on those. Or you can also look in the Alliance for Continuing Education in the Health Professions. Join that organization. It's quite cheap to join per annual rate, and you can get access to the directory. And in the beginning, when I was talking about professional education companies, that organization, Alliance for Continuing Education in the Health Professions, called just the Alliance, that is an organization of all of those professional education companies. So it's really good to join that as a freelance medical writer and put your name in the directory. And then personally, I've attended that conference a couple of times, and last year I attended as an exhibitor. And we had a lot of people stopping by our booth, and we got a lot of work that helped to pay the cost of attending that conference. So it's definitely a good thing to do to either present as an exhibitor, or you can put in a proposal to deliver a talk at that annual conference. Very good thing to do. And then just to clarify, I've sort of mentioned it, but I wanted to give you a visual here. So oftentimes CME, continuing medical education, will start with a pharmaceutical company putting out a request for proposals, RFP. And then the CME companies, that's the companies in the alliance that I talked about, they will fulfill the request for proposals and put their name in and try to win. They usually could win, $250,000 to create an educational program. And then once they've done that, the CME company will get the medical writer to create the materials. And then they will also, before winning the contract with the pharmaceutical company, they will reach out to the medical writer to write the needs assessment, which is the scientific part of the proposal that they submit to the pharmaceutical company. So that's kind of how it works. And the pharmaceutical company is paying $250,000. Don't know how much the CME company makes from that, but they have a lot of staff and expenses to pay. And then the lowly medical writer, we get our sort of hourly rate or a flat rate for doing the work that we do, but we don't have all the headaches that the CME company has. So that's why I like being a medical writer and having a medical writing company. So that is the CME food chain. So let's explore these components of CME writing in a little more detail.